My job today is just to provide a platform for you so you can understand what some of the other speakers are going to talk about and to get a sense for what the issues are in this area. And it'll be brief, 10 minutes. And I thought what I'd do is start with some of the facts around mental illness. I don't know if you would be surprised, but 1 in 5 Canadians, 1 in 5 of us here will experience a mental illness this year. And that's a lot. If it was any other illness, we'd be declaring a state of emergency in Canada, but we don't for mental illness. And what's important about that figure is that it also includes youth. So youth are not excluded from that figure. 1 in 5 youth and young adults will also experience a mental illness this year. And the thing about mental illness is they tend to begin in young people. So you tend to see them occurring late adolescence, early adulthood. And that means that university students are a high-risk group for mental illnesses. And when you think about the stresses that university brings on, exams and assignments and being away from home and living on your own and parties and substances and all that stuff, then you can realize that there's a whole lot more people out there in universities that are experiencing mental health challenges. That they're not illnesses per se, but they are mental health challenges, and they do cause some distress. So there's a much greater burden, I think, of what we would call subclinical illnesses in universities. And as I say, the situational stressors like the exams, being away from home, substance use, they can all create these problems for us. So given that we have a fairly high, what we would call an epidemiology prevalence of mental health problems in universities, what can we do about it? Well, we know that early intervention is crucial. We know that any illness, but in particular a mental illness, will do damage if it's not checked. So the longer you go without supports and interventions and treatments, the more damage that's done. And the kind of damage is psychological and social. So mental health challenges can derail people's educational objectives. It's really hard for you to do well on your exams and meet your milestones, your educational milestones, if you don't have it together and you're not feeling well. And so if you get off your mark with your educational trajectory, you can actually get off your mark on your career trajectory as well. It can take you longer to meet your goals, or in some very significant and severe cases, you may not be able to pursue your goals. So we want to have early intervention so we can minimize the amount of damage that's done. And the problem with this is that most people who have mental health challenges or illnesses don't want to come and tell anybody that they've got them. They don't want to seek treatment. And so we know that only 1 out of 4 people who have a mental illness in Canada in any given year will actually seek treatment for that illness. 3 out of 4 won't. So 3 out of 4 people are avoiding coming for care, even though we have interventions that are successful and can reduce the kind of social and psychological impacts of an illness. So you have to ask yourself, why is that? That wouldn't be the case in any other illness category. Most people would run to a doctor if they thought they had cancer, or if they thought they had diabetes, or if they had a broken leg. You wouldn't sit at home and think that it would go away on its own or hope that nobody finds out. So let's talk a little bit then about stigma. So stigma is the negative social response that we as a society have towards mental illnesses and towards people who have a mental illness. We've learned to think this way. We've been socialized by our group through the media, parents, schools, everybody we come in contact with, although I think the media has a lion's share of this influence. So we think about people with mental illnesses, we have misperceptions, we harbor stereotypes about them. We think that they can't do things when they actually can. We may feel prejudice, we may feel this emotional reaction. We don't like to be around somebody with a mental illness, or we are afraid of them. And this, of course, can lead to overt discrimination where we treat people unfairly, and social inequity. So our social group is not very fair to people who have mental illnesses. And all you have to do is think about so many people living in poverty without the opportunity of having jobs. And some of the mantras we hear from the Canadian Mental Health Association is people want a home, a job, and a friend. The kinds of things the rest of us take for granted are things that they don't get to have access to. So stigma is a leading barrier to treatment. People don't want to come and get a label and be identified if they think they're going to be stigmatized. It's stigma avoidance. And it's because they expect to be stigmatized by others, and they expect people to think less of them if they have a mental illness. People will think less of me. They may consider me to be less competent, that I won't be able to do my job, that I won't be able to be a stellar student. They may expect people to be unpredictable, that they won't be able to socialize appropriately. And this is a big problem in workplaces. When people with mental illnesses try to get jobs, their employers feel afraid that they're not going to be able to socialize. They don't want to put them in the public eye. They're afraid that they'll be unpredictable, or that they'll be socially inept. They won't be able to function socially. In short, that they're not right for a professional career or a particular job. And I'll take just a little break to explain a story to you. I have a student who was a master's student of mine a few years ago who has depression, very significant depression, manages to get through the bouts of depression, and she's a stellar student. She's actually got the highest marks I've ever seen of a student in my program. And she went on to do a PhD in another program, a professional program. And she was having a lot of trouble getting one of her committee members to sign off on her thesis proposal. The rest of us thought it was great. This one particular person hated everything about it. So we suggested that she go and talk to this woman to find out what was wrong. When she spoke to her, finally it came out, people like you shouldn't be in a program like this. And that was said openly, and that was just a few months ago that this happened. So stigma is alive and well on university campuses. So, you know, stigma can take many forms. It can take the form of self-stigma, which is when you believe that you're to blame for your illness, that somehow you're embarrassed, that you're not trying hard enough. If you tried harder, you'd be able to snap out of it. That's self-stigma. So many of the barriers you're imposing on yourself. But you can experience devaluation and discrimination from others. And in this case, the story I just told you was from a faculty member who displayed this devaluation and discrimination towards a student. But you can also experience a more insidious form of stigma at a structural level, at an organizational level. And that happens when we don't have appropriate mental health policies in our organization. So many places have occupational safety policies, but they don't mention mental health. And many organizations don't think that it's their job to create mentally healthy environments for their staff, for their faculty, and for their students. Now we're starting to change the way we think about that across Canada in universities. We're starting to pay attention to the fact that unless we create mentally healthy environments for students, we can't maintain or meet our learning objectives as institutions. But we don't have consistent ways of making accommodations for students who have problems, and it really does fall to individual professors and what they think is appropriate, and whether or not they think a person with a mental illness is malingering, or whether they actually think the illness is a valid reason why they shouldn't write the exam or hand in an assignment late. I don't think university environments necessarily promote psychological wellness. I don't think we think too much about how we organize our exam dates so that people don't have more than so many exams in a week. In my department, we make our midterms all the same week. And we could easily get together as professors and decide we're not going to do that. And we know that everybody's afraid of biostatistics, so let's just leave that one on its own week and let the other exams go elsewhere. But we don't do that. And we don't really think clearly about what are the appropriate accommodations we could make for students and how they can come to us and ask for them without feeling that they're begging for favors, you know, that this is something that's their right. So we need to have institutional buy-in for these kinds of things. How do we change this situation? Well, we need to create structural change. We need to have policies that promote wellness. So we as groups within universities need to advocate for those things, student groups, faculty groups, because I think the intentions are good at the higher levels, but they just don't know how to do it. And we need to make sure that that's on the radar all the time, and that to point out that these things need to have considered thought and they need to be implemented. I think the most important thing, though, that we've learned in the work that I do is called contact-based education. And what contact-based education is when people who have experienced a mental illness tell their personal stories. And what this does is a number of things. First of all, they model recovery. Everybody has ideas about what mental illness looks like, and they're all wrong usually because they come from the media. So people who tell their personal stories will help you understand that the stereotypes that you hold are wrong. They will normalize the situation for you. They model recovery and success for you. And it's hard to tell a personal story. Would you like to stand up here and tell people about an illness that you've had? It's not very easy to do that. So they put themselves out in order for you to understand and to help break down stigma and stereotypes. Today you're going to hear some of those stories. You're going to hear stories from 3 young people who've got firsthand experience with mental health challenges. And I hope that you can use this opportunity to see through the stereotypes that we all have. All of us have them because we've all grown up in the same culture. We've all learned the same things. And you may see these young people as courageous and concerned advocates who are risking negative public sentiment and structural stigmatization by standing up here and telling you their stories in the hopes that they're going to be able to make Trent University a better place to be as a student. And those are my 10 minutes done, and I'll turn the podium over now to have Jane begin to introduce some of your storytellers. Thank you.